Well, hello, everybody, and welcome. I'm Teresa Jenkins. I'm chair of the League of Women Voters of Greater Tucson's Public Programs Committee. So the committee recently created these short programs. They're called Democracy Updates, and they highlight policies or laws and how they impact our communities. So these programs are presented when subject matter experts are available on topics of interest to our members. So they're not done on a regular basis. So for tonight's democracy update, we'll hear from the nation's largest union of registered nurses, National Nurses United, on the topic of Medicare for all. So for over 100 years, the League of Women Voters have been a nonpartisan, activist, grassroots organization, and infancy and maternity care, along with public health, were part of the planks of the National League of Women Voters in the 1920s. So when the nurses union reached out and asked if they could present this program, we readily agreed, as the league is dedicated to working toward legislation that focuses on expanded and improved Medicare for all. In fact, I encourage all of you to take a look at the League of Women Voters of the United States website. You can learn about the league's health care positions, and you can view the healthcare reform toolkit that they have on their website. It's called Healthy People, Healthy Democracy. Our speaker this evening is Ken Canegos, who is a retired nurse and the coordinator of the Arizona Medicare for All Coalition. He has a 45-year nursing career, primarily in intensive care units in Houston, Texas, but for the last 17 years, Ken has been involved in the fight for Medicare for all, dedicating his time, his energy to organizing, to educating, and building coalitions around single-payer healthcare. I'd also like to recognize Yvette Flores, National Nurses United of the California Nurses Association, and a community organizer who's also with us tonight. So welcome, Ken. Welcome, Yvette. So,
Hello, everyone, and thank you
yes.
so
Okay, so after Ken's presentation, we're going to take your questions. So I ask you to use the raised hand emoji. And we'll get to as many questions as we possibly can as time permits tonight. So Ken and Yvette, thank you so much for being here, and you may begin your presentation when you're ready.
Okay, well, thank you. Thank you all so much for having me here today. My name, as you know, is Ken Kenegas. I'm a retired registered nurse, and I'm here with National Nurses United. I'm so happy to be here talking about Medicare for all, the fix we need for our broken healthcare system. This presentation will be about 20 minutes long. There's a lot to talk about, so let's jump in. Here's what I'd like to cover today. First, who exactly is NNU, and why are we here tonight talking about Medicare for all? Next, why exactly do we need Medicare for all? What exactly are the problems with our current system that we're trying to fix? We'll then talk about how Medicare for All fixes these problems through the lens of what we call the 6 principles of Medicare for All. We'll then move into what we're up against to get Medicare for All, and we'll end with how you can plug into the campaign. And let's go ahead and get started with a quick intro into NNU and the Medicare for All campaign. National Nurses United, as you just heard, is the largest union and professional organization of bedside nurses in the United States, representing more than 225,000 RNs across the country. NNU was formed in 2009 as a federation of multiple state nurses unions as a way for nurses to take our fight for better conditions for both us and our patients national. We understand that our fights at the bargaining table aren't just about us. They're about the communities we belong to and serve. Everybody, regardless of whether they're rich or poor, where they live, what language they speak, what they believe, will all be patients at some point in our life. That is why nurses fight for issues that impact both us and the health and well-being of our patients, from safe staffing to Medicare for all. This quote from Nancy Hagens, registered nurse, president of the New York State Nurses Association and a president of NNU, says it all. Nurses are in the fight for Medicare for all because we've seen the consequences of not having guaranteed health care for all. We're the ones who are constantly being told by administrators that we can't do our job because a patient's insurance won't cover the treatment they need. We're the ones seeing patients return to our hospitals multiple times after discharge because they couldn't afford the treatment we knew they needed. So they settled for some stopgap measures and that didn't address the real problem or didn't give them the life-saving care that they needed. This is not the mark of a functional healthcare system. This is what happens when greed comes first. Nurses will never settle for a system like this, which is why we fight for Medicare for all. The 6 photos on this slide represent 6 major failings of our healthcare system and the principles of Medicare for all that they correspond to. Let's quickly touch on these failings and how Medicare for all addresses them. The first failing is that our system is not universal. 27 million people in this country have no health insurance at all, with as many as 17 million more at risk of losing theirs because of the Trump tax cuts that passed earlier this year. These are people who skip care, live with injuries, and yes, die a lot earlier than people with insurance. Under Medicare for all, every person would be guaranteed health care as a human right. The second failing is that our system is really confusing because of how fragmented it is. If you're one of the lucky ones who's able to choose your plan, you often see terms like PPO or HMO, plans with different copays, deductibles, and monthly premiums. If you get your health insurance through the Affordable Care Act, then you also have to pick between bronze, silver, or gold plans. Medicare itself is getting more and more confusing too. You're not alone if you've felt confusion trying to navigate it all. Medicare for All simplifies the system by implementing a single public program, a program that pays for all necessary and appropriate care, streamlining the system and saving billions in administrative and other costs. The third failing is that not all necessary care is covered. Really quickly, can I get a show of hands? Who here thinks it makes sense that dental care isn't covered by most health plans? How about long-term care? I didn't think I'd see many hands. The reality is benefits like dental, vision, hearing, long-term care are all critical services that aren't covered under most plans for one reason and one reason only. They aren't profitable to cover. Under Medicare for all medically necessary care, including medical, dental, vision, hearing, mental health, reproductive, long-term care, and more are fully covered. The fourth failing is that we aren't free to make our own decisions. We don't get to choose our own doctors. We get to choose from a small selection of doctors that our insurance companies select for us based on who they can get away with paying the least amount of money to. And these limited networks don't bring costs down. They just make it harder for people, especially in medically underserved areas, to get the high quality care they deserve. There's one network under Medicare for all, the entire country. You can see any doctor, go to any hospital, and not worry about network limitations. The fifth failing is that our system is way too expensive. As a country, we spend twice as much per person on health care as most other industrialized countries in the world, countries which guarantee health care to their people. Premiums, deductibles, and copays continue to make care too expensive, even for people with insurance. And these higher costs are completely avoidable, which is where Medicare for all comes in. Medicare for all is free at the point of service. No copays or coinsurance, no deductibles. If you need care, you get care, regardless of your ability to pay. The final failing is that our system prioritizes the few over the many. CEO and shareholder profits are valued over patient care. The wealthiest never struggle to get the best care in the world, while the working class struggles to get any care at all. Medicare for all prioritizes the many over the few, not just by making health care for all, but in other ways as well. A major one is a just transition for people whose jobs are disrupted by the transition to Medicare for all, such as those working for health insurance companies, making sure those people can get new jobs, can go back to school to learn a trade, can retire early if they want, or are offered gap wages as they transition to a new career. That sort of support is an important part of Medicare for all. So just to recap one more time, universal coverage, a single public program, comprehensive benefits, freedom to choose your care providers, no cost sharing at the point of service, which only serves to prevent people from getting care, a just transition. These are the 6 principles of Medicare for all. This is how Medicare for all addresses many of the major challenges with our healthcare system. But these principles are not the only ways which Medicare for all is a vast improvement over our current system. These are some of the other benefits of Medicare for all. When we pass Medicare for all, we'll create a healthcare system that puts healthcare dollars to care, not profits. We create a system that sets money aside specifically to make sure that hospitals and clinics in rural and medically underserved areas have access to the best technology and have the resources to stay open and provide high quality care to the communities they serve, all at a lower cost than our current system. If you want a sense of how inefficient our current system is, 1 out of every $3 spent on health care, excuse me, 1 out of every $3 is wasted on bureaucracy, corporate profits, lobbying, advertising, not spent on care. That's how we can afford to guarantee care to everyone while expanding benefits. Our system is just that inefficient. Now let's pivot into talking about the fight to pass Medicare for all. While proposals to create a public health care program have been around since FDR and before, actually, the first Medicare for All proposal was introduced in 2003 by Representative John Conyers. That proposal was reintroduced every session until Representative Conyers retired, at which point Congresswoman Pramila Jayapal and Senator Bernie Sanders took the torch. Unlike the Conyers proposal, which was more of a statement of support for a cause, versions of Medicare for All legislation introduced since 2017 have been detailed implementation ready proposals, and that includes the current bills in the House and the Senate. We've made a lot of progress organizing behind these more detailed bills. The first hearings in Congress on Medicare for All were held in the House in 2019. Throughout multiple points since then, we've been able to secure the support of the majority of the House Democratic Caucus. In addition, our union, along with a number of allied national organizations, has been leading a robust grassroots campaign to build support for the legislation. Unfortunately, despite the progress we've made in pushing Medicare for all, we have a very difficult political climate we're battling right now. Not only is the far right advancing its efforts to roll back people's health care, but the corporate healthcare industry continues to lobby against any amount of progress. And while we've made inroads in building Democratic support in Congress for Medicare for All, a large portion of the caucus, especially in the Senate, is still not on board. And then there's the filibuster rule, which would also have to change in addition to, or else we'd have to have a supermajority in the Senate. Finally, even among supporters of guaranteed health care to everybody, there is some division. Almost all Democrats believe that everybody should have health care. But once you get into the policy weeds, it becomes very easy for the insurance, drug, and hospital corporations to mislead people into thinking that Medicare for All will somehow take away their care and their freedom, even though the current system does those things, and Medicare for All guarantees care and freedom to choose your care provider. Finally, when Medicare for All gains traction, we tend to see alternative proposals come up that just don't accomplish what Medicare for All will, in an attempt to divide public support and redirect it away from Medicare for All. These reforms, like a public option, don't address the root causes of our healthcare system's issues, and in some cases, even make them worse. The good news is none of these challenges are insurmountable. We know this. We know that these challenges can be overcome because they've been overcome before. As you can see from this slide, advocates of the original Medicare program faced similar challenges that we face now, from intense lobbying, then from the American Medical Association, to a Democratic chair of the House and Ways and Means Committee that blocked the advancement of Medicare, to Republicans constantly trying to redirect support to proposals that would not fix the problem. In the 60s, advocates were able to break ideological resistance by unifying the public against the AMA, showing that their defense of the current system was extreme and immoral. They were able to work with President Lyndon Johnson, along with community groups and organized labor, to elect a strong Medicare majority to Congress. They united the public behind Medicare with one simple premise: seniors deserve care and security in their retirement. It worked. They successfully overcame those obstacles and passed Medicare. We will do the same with Medicare for all. In order to overcome our corporate opposition and win, we need to build the same kind of strong grassroots movement for Medicare for all that existed for traditional Medicare in the 60s. Part of that work is exactly why I'm here tonight. We need to continue to build support for Medicare for all in communities across the country. Bring people into the fight. Other nurses are giving the same presentation to groups all over the country. The goal is not only to build more support in communities across the country, but also to build support within the Democratic caucus in Congress. Earlier tonight, I mentioned the massive health care cuts to Medicaid, Medicare, and the Affordable Care Act happening this year as a result of Trump and the Republicans in Congress. An estimated 17 million additional people are expected to lose their health coverage in the coming years. Again, on top of the 27 million people already uninsured today. This is outrageous. Democrats have an opportunity to lead, not just to fight back against these attacks, but to support a real solution that will actually make a difference in working people's lives. And Democrats should lead the charge on Medicare for all, not just because it's a good idea, it's also a very popular one. Nobody loves insurance companies, and most people agree that health care should be a human right. If Democrats want to recapture the support of working people and stop the far right, leading on programs like Medicare for All is how they do that. And third, we're focusing on reducing the influence of the corporate healthcare industry in Washington, D.C., that is preventing Medicare for all from passage. We're continuing our work on the Patients Over Profits Pledge, where we ask sitting elected officials and candidates for office at all levels to pledge not to accept money from the for-profit healthcare industry. To close, I want to touch on ways you can take action. NNU has identified freshman Democrats in Congress who are not yet co-sponsors of Medicare for All, but whom we think will be willing to sign on after hearing from their constituents as well as one senator who was a co-sponsor of Medicare for All in 2019, 2021, and 2023 when he was in the House of Representatives, but is not signed on to the Senate bill. That is Arizona Senator Ruben Gallego. So we are focusing on giving presentations in the districts of those freshman representatives and in the entire state of Arizona. We will be working toward legislative visits in those districts and with Gallego in Arizona within a few months. An organizer with our campaign will follow up with more information about how you can be part of that meeting. And for more information about Medicare for All legislation and our campaign, including fact sheets, our website, and more links to take action, please visit our link tree at the link on this slide. Maybe you can put that into the chat so that people can copy it. I wanted to finish up by thanking you all so much for having me here to speak to all of you. Medicare for All is an issue that's near and dear to my heart as a nurse, and I won't stop fighting for it until we win it. Neither will National Nurses United. But it's going to take more than nurses. It's going to take teachers, firefighters, restaurant workers, small business owners, activists, organizers, everybody that believes healthcare must be a human right. I hope you'll all join us in this fight, and I know that together we will win.
That was absolutely fabulous, Ken. It's very informative, and we can just feel your passion for this. So thank you so much. So let's take some questions. What questions do you have for Ken and for Yvette? Well, I'll go ahead and start. I looked at one of your slides. It was talking about the 1960s when we were looking at Medicare, and the AMA was opposed to Medicare at that time. Is the AMA opposed to Medicare for all, or are they on board?
I don't think they're totally on board, but they're much more divided about it. And the AMA only represents a small portion of the physicians in the country. They're not, as it was back then, they're not attacking it in that way.
Okay, so maybe just follow up. Are doctors and other healthcare providers, are they basically on board as well?
Yes, many doctors and nurses and other healthcare providers have, realized that this is what we need. We need a system that guarantees healthcare to everyone. And it's not that unusual. It happens all over the world.
Okay, let's look at some hands raised here. Marge, go ahead, please.
Hi, thank you very much for the presentation. My question is really a follow-on to what Teresa was asking, and that is how are you going to assure, or how does the legislation assure that a sufficient number of doctors will participate so that we don't have a government program for poorer people and then a separate private rich program or separate private expensive program for rich people?
Well, I mean that's what you get if you do a public option, is you get that kind of a situation. But if you have a national public program that the vast majority of physicians are going to participate in, just like they participate in Medicare now, then I don't think that's going to be a problem. I mean, there may be some people that try to have a little private over here, but they're not gonna have enough volume to be able to include all the specialties and.
Yeah, and I can add on to Ken's response. What we see in some of these other countries that have tried implementing a public payer system or a public system is that they'll often, insurance companies still exist in those systems. And so what they'll do is they'll cherry pick the people who are the least sick. And so that means that the sickest people ultimately end up on that public program, and that causes a lot of strain on the system. And that's how you end up with delays in care. That's how you end up with shortages in funds. And so what we are proposing and what single payer healthcare proponents are proposing is a completely public program that includes everybody. So everybody's in, nobody is out. And what that causes is that everybody is throwing money into the system. And on top of that, we can also create incentives for physicians to practice in areas that typically you see uh, aren't as represented, right? So we see areas where there's the physician to patient ratio is very, very low. And so with a system like this, we can create those incentives that currently don't exist within this system, right? That's how we end up with these areas that just have such a high concentration of physicians and other areas that don't have many. And so that is a really important thing to mention. And then, of course, if we give everybody in the country the ability to have healthcare for their monthly or yearly checkups, you end up with less situations where people end up with really terrible health outcomes, right? One of the main killer in the United States is hypertension. Hypertension is 100% preventable, but a lot of people don't go and get their preventative appointments because they don't have the money. They don't have the money to pay the copays or the deductibles, or they just don't have insurance at all. And so you end up with people who have very awful health outcomes and hospitals who then need to find a way to pay for those folks who forewent or foregoed, trying to get healthcare when they really should have. So those are a couple of different scenarios to take into account with this particular system that we're proposing that's different from other systems in other, I guess you would say, first world countries around the world. Yeah.
Great, thank you. Okay, we'll take Shirley, then Wendy, and then Barb. So Shirley, please unmute.
Yeah, I did. Do you envision this also including prescription insurance? I've been paying for Medicare Part D insurance and just got a very expensive prescription that's going to cost me, my copay for that is over $200.
Yeah, this will also be, it is paired with bringing down prescription prices completely. Yes,
Yeah.
that's another problem that is easy to identify. And, I don't think the legislation actually pays for all prescriptions, but it does focus on bringing down those prices significantly.
And including of forbidding advertising of drugs. Everything you see advertised on television is going to be very expensive.
Very expensive.
Brand name, any brand name.
I think
Medication.
that is something that should be done. I mean, I can remember when it was illegal to do that, and we need to go back to that. I don't think it's part of the legislation, but the legislation focuses on the healthcare system,
Mm-hmm.
doesn't do that one. But I think that if we can pass Medicare for all, we can get rid of the ads on TV also. I agree with you. It's terrible.
Yeah, and just to add on to Ken's response, which is great, is that when you have an entire country that's under one program, right? And they're going to negotiate with these pharmaceutical companies on how much a medication should cost, you have a lot of negotiation power, right? If you're up against an entire country, that's your only provider, you have to come down, right? And so we've seen a lot of administrations, go and try to negotiate with these different companies, but they don't have much power, right? Because there are these private interests, there are these middlemen, they're the insurance companies that are making profit, and they have a lot of power in the system. And so if we were, or when we get to a Medicare for All system, what we'll see is negotiations with prescription companies is going to be far of a smoother process just due to the sheer amount of people that we'd be representing across the country. On top of that, the legislation does say that long-term coverage, vision, dental, all of those additional, healthcare uh, healthcare resources that you'll need over the course of your life are also covered under Medicare for All. And the reason why we can afford to do this, and cover everybody, right, including those other parts of healthcare, is because we spend so much money in the bureaucracy right now. We spend one out of every $3, and I'll say it again, one out of every $3 goes to the bureaucracy, goes to advertising, goes to making profits for a very small amount of people. And so if we're able to remove that, right, remove those middlemen that ultimately have no say in our healthcare, right, that shouldn't have a say in the healthcare that is provided to us by our doctors, we're going to end up in a much better place, right? We're going to be able to use that money for what it should be used for, which is taking care of people. So I thought I would add that to Ken's already great answer.
Perfect. Thank you. Okay, Wendy. Wendy, you need to unmute.
Yeah.
Thank you very much, Ken and Yvette, for this presentation. I work closely, I'm a local physician, and I work closely with Pima County Medical Society and Arizona Medical Association. And definitely we're working very hard on trying to put together a unified healthcare coalition of all healthcare workers in the state and nationally to fight some of the changes that are going on right now. Our effort last year was really to get a lot more training positions funded for Pima County because of the the shortage of physicians. And we're currently working now on fighting some of these access Medicaid and other healthcare cuts that our government is proposing. Also, the criminalization of the healthcare providers has been a big issue we've been working on. We do have two lobbyists in Phoenix that I go up and see periodically that are working right on the floor and have many years' experience with public policy. So they're working with our legislators constantly. And we are trying to get anybody that wants to align with us. So Ken and Yvette, maybe we can have a follow-up appointment to really build a very large healthcare coalition, large healthcare medical coalitions, doctors and nurses, historically in the United States have been very powerful as far as forming a lot of medical legislative laws, regulations, and policies and procedures that have served the American people well. Thank you very much for the work you're doing.
Well, one of the things that we're also doing is we have a petition that is addressed to Senator Gallego. And can you put that in the chat, Yvette? She's going to put a link in the chat. So if people are interested in, helping us on this and being in touch with us in the future for when we set up these meetings with Senator Gallego, sign that petition. Now the petition asks for your zip code and phone number. And evidently those are mandatory on the petition for it to accept your name. So please put those on there as well. And then, yeah, I mean, it sounds like Wendy, maybe you can, if you could take that petition and electronically share it around a bit among the people you're working with, that would be great.
Great, and thanks, Wendy, for all that you do as well.
Yes.
You're up next.
So I just wanted to clarify, and by the way, Ken and Yvette, thank you very much. This was very informative. I'm semi-familiar with this, but this was helpful. Regarding the use of private insurance companies, currently Medicare has a lot of private insurance companies with it. Are you saying that there will not be any involvement with private insurance companies, or will there be a modification to how they're doing it?
Well, they can only offer services, the way the law is written, that are not available under the system. In other words, if you want a private room, you could, get insurance that will get you some, some things beyond care. But Medicare Advantage has to stop. That's not Medicare. That is private insurance.
Thank you.
Thank you, Ken. And Linda Longlip.
Hello, thank you, Ken and Yvette, for presenting this. It's very informational. My husband, Tom, is trying to raise his hand but wasn't able to do that. So I raised it for him and now he can open up his mic and he can ask his question. Maybe. No, you're still muted, dear. Well, all right, I'll have him come in here in this other room and he can talk from here. Hold on a minute.
Yeah, I'm trying to see if I can unmute, but I
Try
have
holding down the space bar.
But he's on an iPad, that's maybe the problem.
Oh, my bad.
There
Oh. we go.
Hi.
Hello.
Hi. I'm sorry for the confusion. I could not unmute. I could not find the little hand raised, but Ken, my question or statement question is, this all becomes very easy to understand from a ideological, from a logical, from a moral standpoint. But I just see, huge hurdles, as you've discussed in your presentation, with that intermediary sector of the insurance world. But people also would listen and support things that affects their pocketbook. And in the process of your research and time with this, have you been able to put together a pro forma for several, I'll call patients, users of the system, in terms of what their costs might be now and what it could be potentially under a single care provider, Medicare for all? And related to that would be, are there other countries that have used this that would provide additional support or credibility to that kind of analysis? I think people can support this logically, but when you can tell them what it's going to do to their pocketbook as well as their quality of health, I think that's powerful.
Yeah, there have been information put out from some groups about how much this would reduce the average person's medical cost, and it's substantial. Like, this would be paid for through progressive taxation, and for the vast majority of people, it's gonna cost them maybe 1/3 or 1/4 of what healthcare costs today. It's hard to determine because everybody's needs for healthcare are different. But there's just so much waste in the system, as Yvette was saying. And I mean, there's like 150 lobbyists, for the pharmaceutical industry in DC, or maybe it's more than that. There's all the propaganda they put out about how you can't do anything but do what we're doing now. And yes,
Well, to me, it's all the more reason to try and identify that kind of tangible cost savings for people, as well as I'll say, the subjective and qualitative issues that relate to it. But that's just my comment, and
Totally. I can
thank you.
actually jump in here. So we know for a fact that the United States spends twice as much on healthcare as any other major industrialized country, which is insane. So I'll say that one more time. So despite spending more money per person on healthcare than any other country, the United States experiences extremely poor health outcomes. So that is that is a given that is known from multiple studies. Now, the patchwork system that we have right now of private for-profit insurance has led to really bloated administrative bureaucracy. And so that costs an estimate from in the study I can send you about $812 billion per year. So just for their administrative costs, the bureaucracy, that comes out to be about $2,696 per insured person. And this is just going to that bureaucracy. Again, what we talked about, advertising, the system, people who work for insurance companies. And although we pay for, this extra cost, right? Our health outcomes are not better than other countries. So for example, in Australia, right? Their bypass surgery costs about $42,000, right? Netherlands, 15,742. Switzerland, 36,509. In the United States, that same surgery costs $75,345, right? An MRI, let's say, very common. In Australia, costs about $350. In Netherlands, $461. In Switzerland, $138. But in the United States, just one MRI costs about $1,145. So we're paying more for the same things. And it's not that we're getting better care in most instances. It's the fact that we're paying for these middlemen to make money off of our pain and suffering. And in 2023, healthcare spending grew about 7.5%. So that's a total of 17.6% of our GDP, our entire GDP, right? And that far exceeds other industrialized nations with projections of about nearly 20% by 2030. So this is a very real, very tangible effect to our economy. And people are still dying. So about 37.5% of US adults still are going without that recommended care. They don't see a doctor when sick. And many fail to fill prescriptions because of how much it costs. And if you look at that compared to other industrialized countries, so right here in the United States, it's 37.5%. But in other industrialized countries, we're looking at about only 11 to 12% of people in the United Kingdom and Germany and the Netherlands who experience these problems. What we're seeing as nurses is that nurses are on the front lines. They're having to be the middlemen, right? They're having to tell people every single day that their pain and suffering is not going to be covered, right? And we believe that these Band-Aid solutions, right? They are not the solution. We see this time and time again. Right now, we're seeing these major cuts at the federal level. But in reality, if we implement a system of the like, we are going to be set, right? We'll be set. We'll have coverage for everybody. No one's going to have to worry about it anymore. But if we continue with the system of the like that we have right now, people are still going to be continuing to make money off of your pain and suffering. And on top of that, it's not guaranteed that you're going to have healthcare for the rest of your life. People were banking on Social Security, people were banking on Medicaid, and now we're seeing people who are about to retire that are scared. They don't know what they're going to do. And so we understand there's a lot of hurdles. A lot of those hurdles are the amount of funds, the amount of money that these private insurance companies have. They have so much money, right? And that money is used very often to buy out politicians. You know, if we had politicians wearing, you know, the logos of every single company that's giving them money, things would be a little bit more clear. But a lot of politicians aren't very upfront about where they're taking money from. And a lot of the times, that's ultimately the biggest hurdle in getting a system like this.
Can you still hear me?
Yeah,
Yvette, I can tell you, I agree with you violently, everything that you said. But in order to move, I'll say tangibly forward in the right direction, I think you got to get the constituents of Ruben Gallego and others to understand. They can look at it and say, okay, it's more expensive in that country, more expensive in this country, but we have to be able to tell them, here's what it's going to do to you. And that, I think, combination of both realms, the macro and the micro, would be pretty powerful. And I know that would be a difficult thing to put together with credibility and so forth, but people vote, a lot of people vote their pocketbook, not just ideologically. So I'm done.
Well, I want to jump in here too while he's moving. And my thought is, and I don't know if you have a comment or not, but in the past, we've heard from Canadian people and from people in other countries that have this, that they have to wait a long time, and it's inadequate service. Now, how do we overcome that?
well, we have a lot of people waiting in this country. We have a lot of people, there's no line to get into. They have to wait interminably. And, you know, these other countries, the conservatives within some of these countries are constantly trying to underfund their system. And, you know, if it's adequately funded, there's no reason that there should be these long waits. And, you know, I think that a lot of what we hear about Canada, from what I've heard about Canada from people who work in that system, is very exaggerated as to their shortcomings. None of these systems are perfect. It's a difficult enterprise providing healthcare to an entire nation, but there's no the idea that you cannot get to a doctor, that you can't afford it, that now people are going to be getting, you know, bills for their premiums for the Affordable Care Act plans are going to be like $10,000, $20,000 a year or more. And that makes it impossible for people to be seen. And we have long waits now to get to see specialists, especially.
Well, we need to get that word out there because people that I talk to are still remembering, 40 years ago when they talked about this. And that was the big concern.
Mhm.
That's
No,
all. Thank you.
you're right.
Well, this has been fabulous. I wish we could take your question, Shirley, but we are running out of time. We are going to be cut off actually, unless we conclude. You know, this was absolutely fabulous, Yvette and Ken. And it just speaks volumes to the fact that we have run over our 20-minute program. We're almost at an hour. So this just speaks to how important this is to people. And your presentation was amazing. And, you know, I know that the path is long toward moving toward this system. The obstacles you describe, the ideological resistance, the legislative obstacles are certainly real. But you know what? We said that with the Affordable Care Act too. It will never happen. And it did. So I really appreciate all your hard work, your dedication, and that of the National Nurses United. Thank you for everything that you do to achieve universal health care. And thank all of you tonight for attending and for your very thoughtful questions. So we look forward to seeing you on our next program. We will advertise that in This Week in Greater Tucson as well as on our website. So thanks for coming. Thanks, Ken and Yvette, and have a great evening, everybody. We'll see you next time.
Thank you, Teresa.
Thank you.